Hi, I'm Dr. Doni Wilson, and welcome to How Humans Heal. Today, I want to focus on understanding the physiological effects of trauma and stress and chronic stress on our bodies. The thing is that a lot of times when we hear about or think about trauma and psycho-emotional stress, we are mainly thinking about how it affects us in our mind and maybe even in terms of our neurotransmitters and our mood. And that's important. I want to make sure and emphasize that I am not dismissing that at all. I really believe that it's important to help assess and address the processes in our mind. And I know that there's so much we can do to help us to recover from the emotional states of trauma and stress or PTSD, post traumatic stress disorder. The studies are very clear. I've been reading the studies on this for decades, and I see it in my patients and I see it in myself. So I want to emphasize that if you have experienced trauma or PTSD or chronic stress in any form, that it's really important for you to be working on it with a therapist, psychologist, psychoanalyst, and also in a spiritual way, whatever that is for you, your spirituality, whether that's with a specific religion or with a connection you have or an understanding you have of being human in this life and in this universe that we live in. Those are all important aspects of your healing. Where I want to focus in this conversation today is about how those psycho emotional traumas and stresses we experience, how it shows up in our bodies. Because it's undoubtable that it does show up in our bodies. As much as we might think it's only in our mind or it's only in the past, it the way oftentimes we realize that we need to address it is because it's often showing up in our body. So you might be experiencing, let's say, anxiety, depression, addiction, substance abuses, cravings, attachment to, different activities as well to help us just cope with our exposure to stress and trauma. It makes sense as a human. We're naturally going to be looking for some way to help us cope with our stress and trauma exposure. And at the same time, you might be noticing digestive issues, whether that's reflux or pain or bowel changes or bloating. So many different possible digestive symptoms that can occur. Also, you might be noticing changes in terms of pain, physical pain, maybe in your joints, in your muscles. Maybe it's diagnosed as fibromyalgia or an autoimmune condition that causes swelling and even redness and pain when you're awake, pain when you're asleep, even head pain, migraines. That's what I had for many years is migraine pain and body pain. And I traced it back to a lot of the psycho emotional stress and trauma that I was exposed to. And so sometimes it shows up as a physical pain somewhere in your body and it's different, can be different for everybody. It can also show up on your skin. For some people, it's different kinds of skin rashes. It could show up in your immune system, meaning you might be more likely to have allergies or autoimmunity or even cancers related to the immune system, inflammation in general, or like a chronic infection, viral infections, either that could be HPV virus, which shows up often for women on a pap smear, an abnormal pap smear, and risk of cervical cancer or vaginal cancer. It can also show up with other viruses like Epstein-Barr virus, herpes simplex virus, you name it. There's many different viruses as well as bacteria and yeast that take advantage of the situation of us being stressed and run down, and then the infections can come in because our immune system is not able to protect us. It can also show up in terms of imbalanced neurotransmitters. So even if you know that you could say, hey, I know I experienced this trauma, so no wonder I have anxiety. And what I do is I take it a step further and I actually look at neurotransmitter levels, things like serotonin level, dopamine level, GABA. These levels can be tested and I see the imbalances that are a result of stress and trauma exposure. We can also have imbalanced hormones, everything from thyroid imbalance, insulin, and blood sugar imbalance, ovarian hormones like estrogen, progesterone, and for men, testosterone as well can be imbalanced. You name it, every hormone in the body can be imbalanced. And the one that I come back to and emphasize is cortisol, which is a hormone. It's our main stress hormone. So it makes sense, right? If we're exposed to stress and trauma, it makes sense that our cortisol is going to respond because being in a human body, our bodies have a built-in protective mechanism. When we are exposed to stress and trauma, our bodies are going to attempt to protect us from that stress and trauma. It's what helps us survive as humans. So we can't turn that off. Our bodies are going to do that. We're going to have the classic fight, flight, or freeze and fawn response, which is part of our nervous system response to stress. It can also be that can be part of our kind of psychological response to stress. How do we fight or flee, right? Do we or freeze? How do so a lot of times in psychology, what you will hear about these psychological responses to stress and trauma. And part of that has to do with how our adrenaline responds. Our sympathetic nervous system has to do with adrenaline. Probably you've heard that fight or flight and adrenaline before, right? Even if the alarm goes off and you feel your heart racing and your hands get sweaty, or you're about to make a presentation or be on stage and you feel your hands sweating and your heart racing, that's adrenaline. We need adrenaline in those times and to protect us from stress. Same with cortisol. Our brain tells our body, the part of our body that makes cortisol is called the adrenal glands. There's two of them, one above each kidney. So they're way down here in your lower back. So the brain sends a signal, a hormone down there that says, come on, adrenal glands, we need some more cortisol and adrenaline in order to respond to stress. And in the moment, that's important. Whenever you might have been exposed to various stresses or traumas in your life, your adrenal glands would have been there to protect you and say, and make more cortisol and make more adrenaline. Well, what happens with that? Then it maintains your blood sugar levels so you can get out of danger. It helps turn off systems that are not necessary when you're responding to stress. Like it says, okay, it's not the time to digest or reproduce. Let's put those on pause. And so we end up in a temporary stress response. The problem is when we've been exposed to chronic stress day in and day out, and when we've been exposed to major trauma, it's like the adrenal glands and the cortisol and adrenaline get stuck in a stress response instead of going back to optimal levels, right? So, usually what would happen is we go into a stress response, like, the classic, the tiger's chasing after us. We go into a stress response. Now the tiger's gone and our bodies go back to optimal levels. Well, what happens in our modern lives when we're just exposed to stress day in and day out, or when we're exposed to major trauma, what happens is the body, it's like it goes into a stress response and it stays in that pattern. It is not able to go back and correct itself to healthy cortisol and adrenaline levels. See, that's the thing. It's not that we want cortisol and adrenaline either on or off. What we want optimal cortisol and adrenaline day in, day out, every day. And what studies show, there's actually studies that show this over decades. This is not a new thing. This is something that researchers and physiologists and longevity experts have been studying for a long time. And I can quote some studies with this video, is to show that when humans have more optimal cortisol levels more of the time, that they end up having less aging, right? They have fewer signs of aging. What are signs of aging? It's all of those symptoms we just talked about, right? Feeling tired, feeling in pain, and even just the things we normally think of aging, like arthritis and bone loss and dementia and risk for other health issues like heart disease and cancer. So when a person has more optimal cortisol levels, they have less signs of aging, which also means they live longer. So that's the reason why we would want to have optimal cortisol levels, because it means then we're going to be healthier for longer. And so the thing is like, say you're a person who has experienced a lot of stress and maybe you're having some of these symptoms of stress and you're thinking, well, what am I supposed to do now? Say you even measure your cortisol levels and you're like, obviously, maybe your cortisol is going to be too high or too low compared to optimal. And you're like, now what am I supposed to do about this? Right now that I see that you can't go back and erase the trauma and stress you've experienced. That's not an option. We can't start over. I wish there might be a start over button, but there's not. So we have to go, okay, this is what I've experienced as a human in my life to this point. What can I do to help my body and my system recover and reset from stress exposure? How do I get my cortisol back to an optimal level? How do I get my adrenaline back to an optimal level? And first of all, I want you to know it's possible because you're not going to hear any of this from the regular doctor's office. It's just simply not what they're trained to pay attention to, and it's not there's no medication to treat this, right? So if there's no medication or surgery, you're probably not going to hear it from the conventional doctor's office. And there's not even good testing in the standard doctor's office to address this. Okay, they can test cortisol levels in the blood. That's only going to measure your cortisol at the time you have your blood drawn. So let's say you go and have your blood drawn in the morning. We at least get a morning cortisol, which is better than nothing. However, it's really not going to give us the information we need when it comes to helping you recover from chronic stress and trauma. What we need is we need to see your cortisol at different times of day because an optimal cortisol needs to be higher, a little higher in the morning when you wake up. When you wake up, the cortisol should go up. That's what helps us wake up and gives us energy to do the things we need to do during the day, right? So we should have cortisol go up, but not too high. And then cortisol should gradually decrease through the day. So by the end of the day, your cortisol is low and it's time to go to sleep, right? Or it can reflect in your energy levels. So if cortisol's in a good range in the morning, you've got better energy. It gradually decreases to low, and that's when you feel like it's time to go to sleep. And it matches up with that circadian rhythm. That would be the optimal cortisol production by your adrenal glands. However, when we are exposed to stress and trauma, like most all of us are in our modern daily lives, then that cortisol level gets thrown off track. It goes a little bit higher, maybe at certain times a day or all day long, or it could be a little bit lower at certain times a day or all day long. And so if we only measure it in the morning, it might look like it's in the range, right? The range is a pretty wide range, so it can be easy to fall into range. And if you see a medical doctor or endocrinologist, what they're looking for is if your adrenal glands completely stop working, right? So if your cortisol goes to essentially zero, it's going to show on that blood test. Or if your cortisol goes way off the charts, that's called Cushing's disease, then it's going to show on those tests. The thing is that those extreme scenarios are pretty rare. It happens. It definitely happens. I hear from people where they're like, yep, I'm one of those people who has Addison's disease, where the adrenal glands completely stop working. Okay, that happens, but that's not the majority of cases. So most of you who are listening, you likely don't have Addison's or Cushing's disease. If you're worried about that, you definitely can get the blood test and check with an endocrinologist. But if they say to you, no, you don't have Addison's or Cushing's disease, that does not mean that your cortisol is optimal. It could be that your cortisol is a little too high or a little too low at certain times a day or all day long. And even if it's a little bit off, it can still create symptoms in your day and it can still affect your quality of life and your longevity, your aging, right? So to me, that's worth paying attention to. I'm the kind of person from a young age, I got very interested in how do I eat and what can I do with my life in terms of my activities and my exercise and my supplements, my vitamins. What can I do proactively to help myself feel as good as I can for as long as I can? That's why I studied not just science in my bachelor's degree, but also I got a bachelor's degree in nutrition because I wanted to understand how food affects our health. And then I went to get a naturopathic degree and a midwifery degree because I wanted to understand what are the things we can do on a daily basis to help ourselves recover from stress and trauma. And there's a ton of research. This is not something that I'm just making up or, coming out of nowhere. There are hundreds of studies on not just cortisol and adrenaline, but also the different things that can help optimize cortisol and adrenaline. And if you love to read research, I encourage you to get at least one of my books. I've written 5 books, and they all have references to studies that show what I'm talking about. What that show it's important to have optimal cortisol and adrenaline levels. And again, this is not something you're going to find out in the regular doctor's office. So if you already went to the doctor's office and you're like, I'm tired, I'm in pain, I'm anxious or depressed, I'm not sleeping well, what else can I do? Right. And the doctor might be saying, well, there's this medication, but that's about it. They're going to be out of options because when it comes to this situation, it's the medications are just going to help with the symptoms, right? You could take a pain medication if you're in pain. You could take a medication that's an immunosuppressive if you're having inflammation, but it's not really getting at the reason for your symptoms. It's not really getting at the underlying cause. So if you're like, okay, I really want to get at the underlying cause. I want to help my body to recover from stress and trauma exposure. Then we need to do a more precise cortisol panel. And these are available. There are quite a few labs that offer them. It depends on the state you're in and it depends on the practitioner you're working with. However, I can tell you the one that I prefer. I'm constantly reviewing different labs and I can tell you which ones are okay and which ones give us the information that's really useful. So when patients work with me, and I help patients around the world, by the way, because I'm a specialist, I can help patients by phone and video. So wherever you might be hearing this from, likely I can help you because you probably have a practitioner locally, and then I can help you with the pieces that they're not addressing. And so I people especially contact me when they're like at the they feel like they've tried everything else and they're like, what else can I do? I want to feel better and nobody else is figuring it out. And I would say it's because most practitioners are not understanding the key core importance of optimal cortisol levels. It just so happens this has been something I've been researching for all these years, and I'm my mind is the kind of mind that looks for patterns and looks for what's helping patients of all different health issues improve the most. And what I can tell you is that it's by optimizing cortisol and adrenaline levels. So what I do is I make it possible for you to order a cortisol and adrenaline panel that you can do from home, from wherever your home is. I can mail you the test kit. It's a saliva and urine test. So you're spitting in a tube at 4 different times a day. You spit in the first tube when you wake up in the morning, and then you spit in a tube midday. I usually say before lunch, and then before dinner, so in the evening, and before bed. And you just spit in the tube and then you put it in the refrigerator and then it comes with a mailing label so you can mail it directly to the lab. And then the other part of it is the urine test because that's where we can measure adrenaline. Adrenaline is also known as norepinephrine and epinephrine, and those can be measured in urine. There's studies that show that these are accurate ways to measure these levels. So we do a single urine collection. It's a second urine of the day. So you wake up, empty your bladder, wait an hour and a half or so before you drink coffee or caffeine, and you collect your urine. Not only is it going to measure your adrenaline levels, remember that's another stress neurotransmitter, but it's also in the urine going to measure your serotonin, your GABA, and your dopamine levels so we can actually see how your neurotransmitters have been affected by stress. Amazing, right? So if you've been experiencing fatigue, anxiety, depression, or any of these other symptoms we've been mentioning, we need to know your neurotransmitter levels, right? How is this not getting measured? I It blows my mind because the studies have been available for decades and the testing is available. I think this should be available to everyone, but it's not yet available in the modern medical system under insurance. So for you to be able to get this information, you need to pay out of pocket. It's a few $100s to be able to do this urine and saliva test. And then what I recommend is to meet with me so I can help you understand what your results mean. It's one thing for you to just get a cortisol level, an adrenaline level, but I don't want you to just be on your own with that trying to solve it. It's taking me years of practice to understand how to address it. But what we do as I can, because of all of my experience in biochemistry and clinical nutrition and herbal medicine and reading research and working with patients and knowing which supplements to use in which order, I'm going to be able to guide you. I'm going to be able to look at your results, which is very individualized, by the way. I mean, I'm looking at thousands of reports of all different people, all different ages, living in all different situations around the world. And I've never had two patients with the exact same results. So that's why, because otherwise, if I did, I would just say, hey, you don't need to do this test. Let's just give everybody the same treatment. But no, everyone is unique. So we need to know your unique. I look at it as you're exposed to stress and trauma, and we need to see what the outfall is specifically for you. What is your serotonin doing? What is your adrenaline doing? What is your cortisol doing? Because it's very unique based on your genetics, based on your family history of stress exposure, based on how your body metabolizes adrenaline, based on your nutrient levels, which is to do with your diet and any other supplements you might be taking. It's also dependent on your toxin exposure. If you've been exposed to different toxins, like mold toxins, for example, or other toxins in your environment, that's going to influence your adrenaline and cortisol levels at this moment. So we need to test your levels to know for you. And then I can guide you specifically. And again, I'm using clinical nutrition and herbal medicine to be able to say, okay, here's how we can safely use nutrients and herbs to help guide your cortisol back to optimal levels. Here's how, if it's too high, we're going to use different herbs than if it's too low. There's herbs called adaptogens. Adaptogens is a term that's used for herbs and plants that help us recover from stress. Isn't that amazing? That here we are, humans on Earth, and there's plants that help us recover from stress. I think that's so cool. So then, how do we even know more specifically which adaptogen is the right adaptogen or combination of adaptogens for you? Because some of them are better at bringing cortisol down, that's too high, and some of them are better at bringing cortisol up, that's too low. So we need to know where you're starting from in order to recommend the correct herb that's going to be most effective for you. Same thing with nutrients. If your cortisol is too high, it's going to be a different nutrient we're going to use than if your cortisol is too low. So to me, it's not worth guessing because you could be spending money buying supplements that say they're good for stress recovery, but if you're taking those and you're not feeling any better, that should tell you that it's not the right formula for you. Why keep taking something that isn't actually showing up as helping you feel better? You should, with my patient, I expect that if we got this right, their energy should be better, their mood should be better, their sleep should be better, they're more productive, they're more doing the things they love with the people they love, and they're preventing other health issues, and they're able to. Some patients of mine are on certain psychotropic medications because they've needed them, or certain pain medications because they've needed them. And as they work with me, sometimes over months, if this is a severe condition, then they're gradually able to work with the practitioner who prescribed those medications and decrease the doses. And that's can be worth it because these medications often have side effects and withdrawal symptoms. And patients are realizing, hey, I don't really want to have to be taking this medication that has other side effects for the rest of my life. If we can help you feel better, get your cortisol back to optimal, your neurotransmitters back to optimal, using nutrients and herbs in addition to everything else you're doing. Again, I never want to say that this is the only thing you're doing. You're also going to be working on your diet to balance your blood sugar levels and to make sure you're getting adequate nutrition and macronutrients. You're also maybe doing work on your psyche and your mindset and your different, there's so many different ways out there to help facilitate recovery. But what I find, this is what my patients tell me, is that when they're doing their psychology work, their mindset and mind work. And doing that along with diet, nutrition, nutrients, herbs together, now they're getting so much faster results. It's way more efficient and strategic way to recover. And not only to recover, but to maintain your health over time. To realize that as humans, we need to be constantly, as in day in and day out, giving ourselves what we need to recover from stress because we're constantly going to be exposed to stress no matter what. As much as we can try to avoid certain stresses, stress is a part of life. In fact, it's essential. We want to be have children and be parents, and that's going to have some stress. We want to have careers and professions and do things we love and travel. But there's also going to be some inherent stress. We want to be exercising. Exercise is a stress recovery method. But if we overdo it, now it becomes a stress and we're going to need to recover. So it's a matter of not just saying avoid stress. I don't even believe that that's possible or worthwhile to try to be stress free. I would never put that out there as the goal. The goal is how do we help support you and your cortisol and your adrenaline and your neurotransmitters to get back to optimal while you're experiencing your human life doing what you love to do so that you can have adequate cortisol and adrenaline levels, which is going to help prevent aging and prevent health issues. So, even for someone who's feeling good but wants to perform better or be more productive in your life or be able to keep up with a busy schedule, this is extremely important. It's extremely important to know your cortisol levels. And some people will say to me, well, if I measure my cortisol and adrenaline today, is that really reflective of last week or next week? And I would say yes, because I've been studying this for so many years and we have done that and I have seen that it doesn't change that fast, right? There might be small variations in your cortisol and adrenaline one day compared to another day or one week compared to another week. But I'm not monitoring those minor variations. What I'm looking at is your pattern. What I see is that as an individual, when you're under stress, your body's going to go toward a pattern. It's going to be toward maybe higher cortisol in the morning, for example, or higher cortisol at bedtime, or low cortisol in the midday. That's going to be your body's pattern. So that's what I'm looking for is what is your body's pattern under stress? And how do I, because people will say to me, well, is it really able to recover? Is it just going to be stuck that way? And I would say, no, it's not stuck that way because I've seen it for myself and many, many patients. By taking these steps, we can actually help your adrenal glands. Remember, it's adrenal glands that are making cortisol and adrenaline. So we can use nutrients and herbs to help your adrenal glands to make more optimal cortisol and adrenaline levels once again and to maintain that over time. It's possible then to know what do you need to do on a daily basis to maintain healthy cortisol and adrenaline over time. And it's going to be rather unique to you. In fact, I'm really hoping that researchers going forward will really take this into account in their studies and say to us, even for, say, an activity that we know helps with stress recovery, like let's say meditation or journaling or counseling and talking to a friend or loved one, we know these things help with optimizing cortisol and stress recovery. But what I want them to do, what I want researchers to do, and if I get to do more research, this is what I would do, is I would want to know for someone whose cortisol tends to be high, how should what amount of journaling and what time of day should they be journaling or meditation or whatever other stress recovery activity? We need to know for this person with this stress pattern, how exactly should they be taking care of themselves compared to someone who has a different pattern under stress. So I have reviewed the research and gotten as much as I can from the research that exists currently. And that's what I put in the book, Master Your Stress, Reset Your Health. So if you're listening and you're like, okay, I want to know more about this. I want to know what I can do. Then I definitely recommend to read the Master Your Stress, Reset Your Health book, which is also available as an audio book if you prefer. And then I've written so many different blogs and also done more trainings like this to help you to understand. Like you could really start on your own to help understand what your cortisol and adrenaline levels are and to start down the path of getting them to optimal. There is a stress quiz that I developed that's based on your symptoms. And I find it correlates quite well to the cortisol and adrenaline patterns. And that stress quiz is free and available on my website. So you could start there. And then if you are like, no, I really need to do the test to know my cortisol, adrenaline, and neurotransmitter levels, then I'll put the link where you can order that from my office as well as a consultation with me so that we can go over it together. Again, it can be by phone or video, wherever you are in the world. We can review those results together, and I can then give you a step by step plan of action of how to help you get your levels back to optimal. And I would say this is relevant again for everyone. I really think everyone should have access to this test. I also hope in the near future that there will be much faster and less expensive ways for you to be able to measure your cortisol and adrenaline levels. We should be able to know in an instant what our levels are at any time of day. And I really believe that in the future of medicine that will be possible. But right now, the best we have is to order a test kit that you can do at home so you can get to know your levels, and then I can start to teach you what you can be using, even alongside medications that you might be taking. This is in my training. I'm trained to understand any kind of interactions between nutrients, herbs, and medications, and to help you to navigate what is safe for you to do. Of course, it's also always important that you have another licensed practitioner on your team. This is not about just picking one practitioner. This is about how do we work together for your health and for you to recognize that because it's tough. Believe me, I get it. When you've been through a lot of trauma and you're experiencing a lot of symptoms and you're feeling awful, it's really hard to get the oomph to take steps forward in your health. But I want to encourage you, if you're listening, that there is these steps you can take, and I know that likely they may not have been done already in your healthcare. This is one of the when I review cases of the patients who've been to all different practitioners, this has often not been done yet. So that's why I'm like, this is essential information that if we don't have this, you could be doing all kinds of different protocols. You could be doing diet changes. You could be taking a bunch of different things to heal your gut. You could be doing a lot of different things to in your health and your supplements. But if you're not paying attention to your cortisol and adrenaline and neurotransmitters, it's going to be a lot harder to recover. It's going to take, it just is because it's so essential to your body's functioning and to helping you to be resilient to stress that comes along, even going forward in your life. So that's why I emphasize it so much for so many cases. And I just want everybody to know because I've seen how much of a difference it's made for me and my patients. So I'm going to put the links where you can access that. You can also access what is called my Stress Warrior program, which is a online program you can even access without meeting with me. You go through the steps of that program, and it teaches you in that program. I teach you in the online videos how to optimize your cortisol, adrenaline, and neurotransmitters. So you could start with that. And then you could continue on with me through online programs to help you to recover. And another option is to work with me one on one so that I can guide you in your case every step of the way. So I'm so glad that you're listening in, and I really hope that this has given you some hope for your health and your future, even if you've been exposed to various forms of trauma, stress, toxic relationships, loss and betrayal, um, different crises that you've gone through. Maybe it's just the pandemic, or even after having a virus like COVID or HPV virus. Epstein-Barr virus. These are all, to me, signs that your body needs help recovering from stress and trauma. And what better way to recover than by optimizing your stress hormones, which is cortisol and adrenaline. And I want you to know that's possible using natural substances and a natural approach, but it's a very strategic approach that's individualized to you. And that's the key. This is not a one size fits all thing. We have to individualize it based on how your body has been affected by stress. And that's how we're going to get the best results. If we don't individualize it for your specific imbalances, then we're not going to get anywhere. So if you've already been trying and you're like, why am I not feeling better? Then I would say it's probably because we don't have enough information to individualize it for you, and we need to get that information so then we can make a specific protocol for you to understand your body's needs. Even if we're all human bodies, we don't all metabolize the same way, our nutrients, our hormones, our neurotransmitters. And we can also look at genetics. It's one of my favorite things to do, but we don't always have to do it. But if you have an interest in looking in your genetics, I can help you with that too. We can run a genetic panel to see where is it likely that your neurotransmitters and your adrenaline and your metabolism is getting stuck. And then we can use nutrients and herbs again to help to address those areas. Just because you have certain genetic variations doesn't mean you're stuck with health issues. It means to me, okay, that just means we need to learn how to support your body based on your genetic variations so that you can improve your health and improve your longevity, which is to me the optimal goal, right? So if you're with me, if you're like, hey, I want to be increasing the years of my life and quality of life and preventing health issues as best I can, then this is a key place to be addressing. And I'm happy to help you do that. Thanks for joining in to How Humans Heal today. Please subscribe and join my newsletter. And so you're going to hear the next episode that comes out and receive my next blogs and so on, so that you can keep on learning and keep on helping your body to heal. All right, I'll see you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.